Absolutely. So if you're thinking about Black older adults, today's event is designed to talk to Black older adults about the importance of research. Why do you think it's particularly important for Black older adults to participate in research? And Luther, I'll swing back to you.
Oh, no problem. Well, it's really important because Black older adults, actually will be able to live better lives and healthier lives if we're successful in that. And we can't be successful if we don't participate and engage. I just think about my fairly recent experience with Dr. Neighbors with his diabetes research. It was research, but as a participant, no, it really would not have struck home with me that my exercise, or my movement, I should say, is so important, because in that process, we ate, we took our blood sugar, we exercised, and that really strenuous. I mean, really light. I wouldn't even call it moderate. We walked and we did some fancy walks, and after that, took the blue close measurements again, with a glucometer, and it had dropped at least 20 points, maybe even up to 40 or 50 on some occasions. And that just not only blow my mind, but the other participants, it blew their minds also. So I know that that's important, but everyone, and particularly Black men, need to know you can't slow down, when you get older. And so that's something that research dissemination, and really, I'm going to say go beyond that, and to actually promulgation needs to be done. But I know that that's just one area. But we need to participate, and I guess I'm going to call out to my fellow elder Black men, or maybe I shouldn't say elder, maybe I should say seasoned Black brothers to come and participate in larger numbers. You will not regret it.
That's an excellent point. The opportunity to participate in research helps you, to help others, but also help yourself and know your own health status. So yeah, that's an excellent point. Ella, do you have anything to add?
Yeah, and even from the woman's perspective, we're not much better at taking care of ourselves. We're a little bit better, but not where we should be. And I think about how the three of us are here now. At one time, we could think about looking way down the road and looking at getting older. Well, we're getting closer to that point, and at least one of us that I can personally talk for, we're there myself. And what I thought about when I started to think more about this, how we pride ourselves in being so resilient. We're tough, we bounce back, we can do it, we can take it, we're good, but that doesn't last. And so if we don't know much about our bodies, if we don't know much about the conditions, even the heredity piece, what we can inherit from our families, if we haven't taken the time to really delve into that, we could be in some, and we can't help anybody else if we don't help. So that's why it's important to me to recognize that resilience wears old. We're getting old. We have to be in a position to do better for ourselves.
Yeah, you make a really good point. A lot of older adults in the community see themselves being responsible for others, but you can't take care of other people if you're not taking care of yourself. And so, just participating in research and knowing your health status can certainly help with that. Ms. Sadler, any other comments you want to make about that question?
One of the eye openers that I've experienced is the fact that we can and are being heard as Black elders. I'll give you an example. I was having trouble reading the label on medication. And I wrote a letter stating that to whatever company it was. If it was the pharmacy, I don't remember who I wrote the letter to, but I took time to write a letter. And in the letter, I said, you expect us to take this medication in order to stay healthy. But if we cannot read what's on the label, we're more apt to put it aside. And do you know, in the shortest amount of time, I think it was just a matter of weeks, the font on that medication increased. And so that told me that we do have a voice as Black elders, whether they recognize that, you know, we were Black or not, just the fact that we were elders and speaking up, that people do listen. So I think it's so important for Black elders to be a part, African Americans, period, to be a part of all type of research. And I was impressed with a project that I just participated in dealing with eye tracking and tracking how we read labels on medication. And it's just good to be a part of all of that so that they can understand us as well as us understand what they are doing to try to help us medically.